Opioid facts for teens. You have probably read or heard a number of news reports recently about the opioid overdose catastrophe. However, what are opioids? And why exactly are they such an issue? You might not be aware of this, but it's probable that your doctor prescribed you an opioid painkiller if you've recently had surgery, dental work, or a sports injury. Opioids are powerful painkillers, but they may also be exceedingly addictive and should only be used under a doctor's close supervision. There are other opioids than those prescribed to you by a doctor, such as heroin, which you've probably heard of. Heroin is a very hazardous substance that is typically injected with a needle into a vein. Both heroin and painkillers share the same chemical makeup, and both are highly addictive and can result in fatal opioid overdoses. In 2016, 2.14 million persons aged 12 and older, including 153,000 12 to 17-year-olds, had an opioid use disorder. We want to arm you with information so you can make wise decisions and be the best version of yourself. We hope you will use this video to educate your friends, parents, teachers, and other people about opioids. Deaths from opioid overdose. There is currently a national issue as a result of the rise in opioid overdose deaths. Prescription medicines are the most often abused substances in the nation, second only to marijuana. 115 Americans pass away from an opioid overdose per day. 5 times as many people died from opioid overdoses in 2016 as there were in 1999, including those caused by heroin and prescription drugs. 3. The government declared a public health emergency as a result of this. This catastrophe has impacted people in every state and neighborhood. Every aspect of your life can be impacted by opioid use. Drug use, especially early in life, can result in low academic performance, subpar athletic ability, and strained friendships and family ties. Opioids also affect judgment, which can lead you to take risks you wouldn't normally take, such as engaging in unprotected sex or crashing your car while driving while under the influence of opioids. Addiction. Misuse of opioids can lead to addiction. One of the most addictive medications is opioids. The body develops a strong desire for the opioids when addiction takes place. This is similar to when you haven't eaten in a while and are extremely hungry. Some people continue to use opioids despite the risks due to this strong desire and a loss of control over their drug cravings. How do opioids work? It's possible that you overheard someone discussing opioids without even realizing it. Slang for opioid medications includes the phrases oxy, perks, and vikes. The opium poppy plant naturally contains opioids. This plant is used to make some opioid drugs, while scientists make others in laboratories. Opioids have been used to treat pain, coughs, and diarrhea for hundreds of years. Some text goes here which opioids are most frequently used. Oxycodone, OxyContin, hydrocodone, Vicodin, codeine, and morphine are the most widely prescribed opioids. Although heroin is an opioid, it is not a drug. Fentanyl is a potent prescription painkiller, but drug dealers occasionally mix it with heroin to produce doses that are so potent that people are overdosing and passing suddenly. How do opiates function? Only 1 in 100 young adults aged 12 to 17 misuse prescription opioids at this time. There are several receptor-containing molecules in your brain that take in signals from various bodily regions. The brain, spinal cord, and other organs' nerve cells have receptors that opioids cling to. They are recommended for serious illnesses or injuries because they have the ability to block pain signals that are delivered from the body to the brain. A significant amount of dopamine is also released in the brain's pleasure centers when opioids bind to the receptors. Dopamine is the neurotransmitter that makes us feel good and drives our behavior. The opioid's dopamine-releasing effects induce a surge of intense pleasure and well-being to spread throughout the body. What are the physical and mental health implications of opioids? 57% of 12 to 17-year-olds who misused prescription opioids did so with a friend or family member's help. Some people may experience a short-term surge in happiness and relaxation as a result of their body's release of dopamine. However, it can also result in additional negative side effects, such as excessive drowsiness, disorientation, nausea, vomiting, and constipation. Opioids can eventually cause addiction, heart infections, pneumonia, sleeplessness, and muscle pain. What is the misuse of prescription opioids? taking your medication outside of the recommended dosage range or more frequently than recommended. Utilizing prescription medication obtained from a friend or family member, even if it is for a legitimate medical need. Getting high on prescription medication. Combining alcohol or other substances with prescription painkillers. My doctor has given me an opioid prescription, so they can't be all that horrible, can they? Opioids on prescription are used to relieve really bad pain. These medications are occasionally provided to those who have undergone severe surgeries, such as dental work, serious sports injuries, or cancer, in order to control their pain. Opioids are relatively safe when used as directed and can temporarily lessen pain. Opioids can, however, have hazardous effects if the substance is misused and not used as directed. If I get harmed playing soccer, is it okay to take the prescription painkillers that my friend has? Even if you are experiencing genuine pain, it might be risky to use someone else's prescribed medication. Doctors take into account a wide range of variables when prescribing opioids, including the patient's weight, any underlying illnesses, and any drug interactions. You won't know how the opioids will affect you or what dosage you need to take unless you speak with a doctor. Never share prescription opioids with others, and only take them as directed by a physician. Drug information for teens. Drugs and heroin. 20% of students in the 12th grade claimed that they could readily obtain heroin if they wanted to. Morphine, a naturally occurring chemical obtained from the seed pod of opium poppy plants in Southeast and Southwest Asia, Mexico, and Colombia, is the primary ingredient in heroin. It is possible to inject, sniff, snort, or smoke heroin. Heroin is also known by the aliases Big H, Horse, Hell Dust, and Smack. What link exists between opiates and heroin? Opioids include heroin. Both heroin and prescription painkillers can have effects that are similar to each other's chemically. In certain areas, heroin is more affordable and accessible than prescription opiates. As a result, individuals who are dependent on prescription opioids occasionally move to using heroin. According to data from 2011, between 4 and 6% of persons who misuse prescription opioids move to heroin, and 80% of people who first misused prescription opioids go on to use heroin. More recent findings indicate that people typically use heroin as their first opiate. 1/3 of people in treatment for opioid use disorder who participated in a study said heroin was the first opioid they frequently used to get high. Because heroin is less expensive and easier to obtain, some people who become hooked to opiate painkillers turn to it. Only a small percentage of those who abuse painkillers eventually convert to heroin, though. Less than 4% of those who had abused prescription painkillers began using heroin in the subsequent 5 years. The amount of persons using and becoming addicted to heroin will be decreased by preventing opioid abuse and ensuring those with opioid addictions receive the care they require. How many individuals use heroin? In recent years, there has been an increase in heroin use. In the last 15 years, the number of heroin users has more than doubled, reaching nearly 1 million in 2016, including 13,000 12 to 17-year-olds. What impact does heroin have on the body and brain? The opioid receptors in the brain and body that cause a rush of dopamine and extremely high levels of euphoria are what heroin binds to, much like other opioids do. Additionally, there are short-term side effects such as dry mouth, nausea, vomiting, intense itching, and foggy thinking. If the dosage is too high, you can cease breathing and pass away. Injecting heroin can cause blocked veins, sleeplessness, heart infections, liver and kidney problems, depression, and addiction. HIV and hepatitis C infection rates are higher in drug injectors. Blood and other bodily fluids are the means by which these two diseases are spread. They may be exposed to these fluids if they share needles or other drug-related supplies. Unprotected sex, which drug use increases the likelihood of, is another way that HIV and, less frequently, hepatitis C are transmitted. Are opioids detectable in drug tests? Opioids can, like other drugs, be detected in a drug test within hours of use. Opioids, including heroin, can be detected in a drug test for days or even weeks after use. 9. 10. The amount of time they remain in your system is determined by how long you've been using the drug, how much you use, and/or your metabolism, how your body handles the drug. When pregnant, is it safe to take opioids? Even when taken as prescribed by a doctor, opioid use during pregnancy might result in miscarriage or low birth weight. Additionally, it can result in neonatal abstinence syndrome, a medical disorder in which the infant is born opioid dependent and has withdrawal symptoms after birth. Without professional assistance, a pregnant woman who attempts to quit using opioids abruptly risks endangering the unborn child. In order to increase the likelihood that the baby will be delivered healthy, it is crucial for the woman to inform her doctor about all medications she is now taking or intends to take. There are remedies that can be beneficial. The drug fentanyl is something I've heard about. And what is that? The opioid substance fentanyl is 50 times more potent than heroin. In medicine, it is applied to surgery and the treatment of severe pain. However, it is currently produced illegally and is occasionally laced with other narcotics, which can cause overdose. Yes, opioid abuse can alter the brain over time and result in addiction. Addiction occurs when a person deliberately seeks out more and more of a drug while using it despite the negative effects. Opioid addiction is a common problem that can result in lethal overdoses from dosages high enough to halt breathing. However, many patients who take opioids on prescription for pain develop dependence rather than addiction. Dependency indicates that your body has grown accustomed to the medication and that stopping suddenly would hurt and feel uncomfortable. Patients who use opioids prescribed by their doctors should ask them how to cease using them in a secure manner. Without being addicted, a person can be dependent on a substance. But if you don't try to stop taking drugs, sometimes dependence can turn into addiction. Can opiates be used to treat addiction? Opioid withdrawal can be challenging, but it is achievable. To treat opioid addiction, 3 medications have received FDA approval. In order to lessen cravings, drugs like buprenorphine and methadone attach to the same brain receptors as prescription opioids do. Another drug used to treat opioid addiction is naltrexone, which works by stopping the effects of opioids on the brain. In addition, a drug called lofexidine has just received approval to help people who are trying to stop using opioids experience fewer withdrawal symptoms. A person's ability to stop taking opioids, mend fences with friends and family, and develop useful life skills all benefit from counseling and therapy. Opioid addiction has been successfully treated with a mix of behavioral therapy and medicines. In order to meet each patient's specific needs, doctors create treatment programs. Do withdrawal symptoms occur when someone tries to stop taking opioids? Yes. When someone stops taking opioids, they may experience withdrawal because their brain has grown accustomed to them. Sweating, shaking, vomiting, restlessness, and diarrhea are some withdrawal symptoms. Even if someone wants to stop using opioids, it may be difficult for them to do so due to the severity of the symptoms. To stop using drugs, it may be necessary to try multiple times. Opioids are capable of overdosing. You can, indeed. In fact, the number of overdose deaths has nearly tripled over the past 15 years, and opioids are mostly to blame for these deaths. Slowing down your breathing is one of the ways opioids calm your body. When abused, opioids might cause you to breathe too slowly. You might completely cease breathing as a result, which could result in an overdose. One dose is all it takes for some people to stop breathing. Can you halt an overdose of opioids? If you move swiftly, yes. Call 911 if you believe a friend or family member has overdosed on opioids so that they can get help right away. When the paramedics come, they'll probably provide naloxone to the patient. The opioid effects are immediately stopped by naloxone. It is offered as a nasal spray, an auto-injector, and an injectable solution. While some states demand a doctor's prescription, others permit pharmacists to sell naloxone over the counter. Because of this, loved ones and friends can utilize it to help someone who is overdosing. The individual who overdosed should seek medical attention right away after using naloxone because it doesn't replace it. What safety measures can teenagers take? Take responsibility for your health. Teenagers should resist peer pressure to use opioids for pleasure, and only take them as prescribed by a doctor, which is the best thing they can do. Even then, opioids should only be used for a brief period of time. Ask your doctor or dentist how quickly you can stop taking opioids if they are prescribed to you for a painful disease and if there are any other medications you can take in their place. Continuous search for solutions. Better strategies for treating and preventing opioid usage are being investigated by researchers supported by the National Institutes of Health. They are investigating the effects of opioids on the neural circuits in the brain in an effort to create safer pharmaceuticals. It would be ideal if they could create a painkiller with the same potency as an opioid without the danger of addiction. Researchers are also looking into alternative pain management strategies, such as massage treatment, exercise regimens, and approaches that stimulate certain brain regions without the need of drugs. Additionally, scientists have improved how drugs are administered to the body. For instance, a device that sprays medication into the nose can now prevent an overdose. Instead of taking a tablet every day or every other day to treat opioid addiction, new injection products and body implants can now be put into a patient's arm to give medication more gradually over months. How is the overdose epidemic being addressed? Misuse of opioids has escalated into a national public health emergency. Fortunately, the federal, state, and local governments, advocacy groups, and healthcare professionals are collaborating to address the situation from all directions. A comprehensive public health strategy is being used to increasing access to rehabilitation and treatment services, encourage the use of medications that reverse overdoses. Improved public health monitoring will help us better comprehend the crisis. Create pain management solutions that are safe and effective. Medications that are more effective at treating opioid addiction are needed. Improve pain management techniques.